The festive season is usually a busy period for the healthcare sector, and after a year of lockdown, South Africans have been enjoying the relaxed regulations, often without required protocols. This has led to an increase in infections, catapulting the country into a second wave, and frontline workers are feeling the strain.
We're just kicking into the second wave at the moment, and basically it's scary times ahead. I must be honest. As you can feel the atmosphere in the hospital, you can actually cut the tension with a knife. It really is a scary time. No one knows what to expect. No one knows how bad it's going to be.
I think the morale is, after going through the first wave of COVID, which gave us extra challenges, of course. We had to cover the COVID wards. Also, our colleagues got infected, so we had to make up for these ones. So people, I must say, doctors are quite exhausted now, and we can feel it amongst the colleagues that we are actually struggling a little bit to keep our motivation up.
We've been receiving a lot of sick patients, but we are disturbed by the number of trauma cases that we are receiving. Some of them getting to the hospital being drunk and uncontrollable. So we are also worried about them. They are not wearing masks. They just come in and fight in the hospital, as well as we are receiving the other patients who are very sick that we have to attend to. Yes, people are so sick out there. This is very serious.
Health authorities here in Gauteng say that they are confident the facilities are ready to deal with the surge of COVID-19 cases that are expected to rise in the coming weeks. Just as the country goes into its second wave, we're here at the Chris Baragwanath Hospital, where the MEC for Gauteng Health was visiting the facility to get a sense of its readiness.
We do have enough beds, and with the capacity that was explained to me this morning, I think we will be able to cope with the surge unless something drastic happens, because we're also in the process of filling vacancies. They've already recruited quite a number of clinicians and doctors and your porters and your cleaners. We hope that the situation will not be worse from next week, as we will be receiving our holiday makers.
We continue planning to be even more ready for bigger extent of the surge. We do so by continuing to appoint staff members to support the project. Our HR is working very hard. We've got even higher number of people that will start on the 1st of January. That includes doctors, nurses, support staff, cleaners, porters, and so forth. And that is all done in anticipation of the bigger surge, as the MEC have just indicated. Our infrastructure, more work was done in the first phase, so we are still very much ready in terms of infrastructure.
Health facilities in the province are hoping that the alcohol ban will ease the burden on trauma units. Hasina Gori, SABC News, Johannesburg.